Hello, I'm Joelle Prescott. I'm here to present twin-twin transfusion syndrome, definition and staging. I'm Joelle. I'm a CNM WH&P student at Frontier Nursing University. Here's a picture of my son, Ridge, helping me write this research paper. Besides being a mom and a student, I am a registered nurse on a labor and delivery floor at a nearby hospital. This is a picture of me helping take care of a twin I helped deliver. So, twin-twin transfusion syndrome is unequal blood sharing between two twins. It consists of a donor twin and a recipient twin when the blood flow is unequally shared, which results in a cascade of problems for each donor and recipient twin. A brief introduction. The unequal blood sharing is created by placental anesomes, which is unequal branching between both twins. There's placental branching because both of the twins share a placenta. In the picture to the left, this shows even placental anesomes in a normal twin pregnancy. To the right is a twin-to-twin pregnancy. You can see that the unequal blood sharing causes a donor twin and a recipient twin, which creates the blood flow between the twins to be very unequal, chaotic, and organized, and it causes problems for both donor and recipient. So the twins are both staged in stages 1 through 5 in a Quintero staging system in which an algorithm is followed to properly diagnose, manage, and treat both twins. In order for the donor and the recipient to begin the twin-twin transfusion cycle, in an ultrasound, it is oligohydramnios and polyhydramnios is detected, and the ultrasonographer would detect a donor twin and a recipient twin. These twins would both be identical, share the same placenta, and would have a possibly big weight discrepancy, which is also called a growth discordance between both donor and recipient. So once you see both twins in a pregnancy, they try to rule out twin-twin transfusion syndrome. So a sonographic definition of TTTS is when a sonographer discovers a single placenta, the twins being the same sex, they're identical, with the fluid volume discordance, which is the oligohydramnios and the polyhydramnios. Once this is discovered, the provider will begin to treat the twins by using the Quintero staging system. This is a universal way to manage the twin pregnancy. In the Quintero staging system, there are 5 different stages of disease process categories for both the donor and recipient. The first stage is when oligohydramnios and polyhydramnios are detected. Oligohydramnios is of amniotic fluid below the 5th percentile of an average fluid level. Polyhydramnios is above the 95th percentile in an average amniotic fluid level. Both oligo and polyhydramnios cause a cascade of disease processes to happen as a result of either too little or too much amniotic fluid. This can include for oligohydramnios and the donor twin to develop anuria and to develop anemia, hypotension, and renal failure. And the recipient twin, after polyhydramnios is developing, it's common to notice hypertension, cardiac failure, polyuria, and can eventually lead to a demise in that twin. Second stage is when a provider notes a non-visible fetal bladder in the donor twin. This is created by the donor twin not peeing. It indicates that there's renal failure going on and that not enough blood and fluid is circulating in this donor twin. Third stage is chaotic, worsened, reversed venous blood flow in the umbilical vein. This is when you see when you look at the image to the left, the blood flow is chaotic and unorganized. In a normal pregnancy, the umbilical blood flow is a nice waveform, and you see that that is not what takes place in a twin-twin transfusion syndrome pregnancy. To the right of this picture is a photo of the twin being stuck in the uterine wall. This means that the donor twin has oligohydramnios to the extent of when there's very little fluid and the twin is literally stuck to the fluid wall. The fourth stage is when hydrops is discovered in the donor or recipient twin. It is, however, more common in the recipient twin because hypertension is developing, there's too much blood flow circulating, and this twin becomes edematous and eventually leads to cardiac failure, which is the hydrops being indicated and recognized. Fifth stage is a demise in one or both twins. In this Quintero staging system, for each stage, there's an algorithm that Simpson and the Society for Maternal Fetal Medicine developed to treat and manage appropriately. So here is a picture of hydrops. It's pretty significant. As you can see, twin B's heart is by far larger than twin A's. It's edematous, and you can definitely see that cardiac failure is taking over this twin. So, the algorithm management for twin-twin transfusion syndrome is basically defining that once stage 1 is recognized between the twins, it's indicated for the provider to frequently have ultrasounds done on this pregnancy, at least weekly. And they're checking for amniotic fluid levels and also hopefully ruling out that the twins are regressing from stages 2 through 5. These twins can regress quickly. One week they can be in stage 1 or 2, and the next week be in stage 3 or 4. So it's very important to follow the algorithm for the viability of both twins. So stages 2 through 5 in the algorithm, it's recommended once the twins reach 26 to 25 weeks. In stages 2 through 5, it's recommended that they see an expert provider that is an expert in laser ablation surgery. They would try to correct the placental anosome so blood flow is more equally shared between the twins. It does carry its risks, but at this point, it may be better for the twins' overall outcome or for one twin to survive to have the laser ablation surgery. For some reason, the placenta would not be a candidate for the laser ablation surgery. Another option would be an amnio reduction in the twin that has polyhydramnios. Once the twins are past week 25, according to the algorithm, the twins can either do what's called an expectant management, when the provider would just expect the twins to get worse and deliver once indicated, or once they're past the 25-week mark, they could consider the laser ablation surgery further, or if the twins eventually go into stage 5, it's indicated that immediate delivery is recommended in order to ensure the viability of at least one twin. So in conclusion, twin-to-twin transfusion is very chaotic and it's very dangerous in nature. It does sometimes have a grave diagnosis. Twin-twin transfusion syndrome is not something that we would wish upon anyone, but if we follow the universal management offered by the Quintero staging system and the algorithm Simpson and SMFM recommends, these twins do have the best chance and the most optimal outcome could happen if you follow the algorithm. Thanks so much for watching.